Hello, and thank you for joining our community discussion on overdoses in San Juan County. We began holding these online community discussions last year because we saw a need to call attention to the rising issue of opioid misuse and overdose in our community. Since 1999, the rate of drug overdose deaths in San Juan County has more than doubled. And according to the New Mexico Community Survey, the percentage of people who currently use painkillers to get high has also increased. San Juan County Partnership has brought together a community action coalition to begin addressing different aspects of drug misuse and prevention efforts. This group consists of local organizations and individuals who want to see positive change happening in San Juan County around reducing overdoses and increasing access to recovery services. Today we have some community experts here to talk about what drug trends we are seeing in San Juan County, why we are suddenly seeing an increase in fentanyl, and why it's so dangerous and leading to so many overdoses, and some things we can do to help our friends and family and ourselves. So joining me today, we have Samantha Smith, Program Coordinator for San Juan County Partnership, Captain Dylan Whitcomb, Corporal Kyle Davis, and Jenny Behan, Pharmacist. Thanks, guys. Thanks for coming. Yeah, happy to have you. So let's talk. The first question is, what are some drug trends occurring in the community right now? So I will toss it over to you, Corporal. Go ahead.
Just common drug trends that we're seeing in the community is methamphetamine is really big here in San Juan County area, as well as heroin. Some trends that are starting to pick up, we're seeing a lot more fentanyl on the streets, getting laced in with heroin and other opioids like that. So.
Some pretty dangerous, yucky drugs out there. Maybe Officer Whitcomb, you can shed some light on some stats about what's happening in the community.
Yeah, I mean, it kind of goes along with your introduction about these things doubling over this past year. We've noticed that in the city. Last year, for the entire year, we ran about 88 what we would specify as opioid-related overdose calls. So far this year, we're at 182. So we've obviously more than doubled that, or will more than double that. And then as far as our medication administration to treat those, last year, and this is just for our agency alone, which probably would count for less than 50% of the actual Narcan administration. Last year was 7, this year we're already at 9 Narcan administration. So yeah, I mean, it clearly has increased significantly this year so far.
So when you say last year was 7 administrations, do you mean over the course of 12 months then?
Correct, over a calendar year.
Okay, and we're already at 9 halfway through this calendar year.
Correct.
Okay.
And last year is included also, that calendar year just includes our agency's drug administrations, our medication administration.
Right.
So, I mean, roughly that's probably close to 50% of the actual Narcan administrations that are happening between us, the police department, and of course the ambulance service.
Right, gotcha. So let's go to the pharmacist here for some expert drug questions. So fentanyl, what is it? What is it used for? How often is it prescribed?
Fentanyl is a synthetic opiate used for pain relief. It has a pretty controlled, as far as the amount that's being prescribed. It's usually saved for chronic pain conditions where they've already maxed out on other opiates like morphine or oxycodone, cancer patients, terminal patients, things of that nature. It is an extremely potent opiate. It's about 80 times stronger than morphine per milligram. So it is very deadly. A very small amount of the medication can stop your breathing and cause an overdose almost immediately in somebody who's never used it before or isn't accustomed to taking opiates. So that would be.
And what kind of forms does it come in, right? Like I've heard of fentanyl patch. What else is there?
So again, it's used pretty rarely as far as us actually dispensing it in the pharmacy. The fentanyl patch is probably the most common. They make lozenges for people as a prescription product, and that would be primarily the two. I think there's also a buccal tablet, so like a dissolvable tablet for hospice patients that can't keep medicine down and don't have time for a patch. And then generally in a hospital setting, it would be given as an IV or in an epidural.
Gotcha. Okay.
So what we're seeing, I mean, I'm sure what you guys are seeing is a powdered form of it where it's coming in and they're adding it to other opiates or cutting it in with other narcotics.
Gotcha. That was my question, was what types of forms you guys are seeing.
Yeah.
So on the street level for, law enforcement wise, we've been seeing a lot of blue pills molded as if they are oxys, and people take them thinking that they're Oxycontins, and they're in fact fentanyl. So, and that's where we're seeing a high increase in fentanyl overdoses, is because they're thinking that they're taking something else when they're really not.
Gotcha. So like, and we're kind of going off, but I'm fascinated by this. When it comes to as a family member, or like specifically as a parent, is where I always go, not being in tune with like teen culture and stuff, and I find something that is an unrecognizable pill. What am I supposed to do?
So anybody can get on drugs.com and just go to pill identifier. You could type it in like these fake oxys. They are blue round shaped with the imprint M30 on them, which is the same imprint for Oxycontins. So anybody is allowed to get on pill identifier and figure out what exactly pill you have right in front of you, which I recommend. If you ever find anything that you don't know, just look it up so you know what you're dealing with.
Right. That makes sense. So Captain Whitcomb mentioned the Narcan, which you have in your hand. Do you want to talk a bit about that?
Sure. So Narcan is a opiate reversal. It will actually go in and kick out the opiates off all the receptors, so it will reverse an overdose. It is a nasal spray, and at the pharmacy level, we encourage everyone filling an opiate prescription to fill a Narcan prescription as well. Every pharmacist and pharmacy in town is able to administer it, prescribe it to you, hand it to you. You don't even have to have a prescription for an opiate or any history of opiate in your profile. It's just, the way I explain it to patients when I'm encouraging them to take it is to think of it like a fire extinguisher in your home. You want to have it for sure, have everyone in the house know where it's stored and know how to use it, because you don't know when somebody's going to overdose. It might be a neighbor that comes over and has a beer. Well, they might have a lot of narcotics in their system, and that beer pushed them over the top, and now you have an unconscious person. Well, this is step one, and if they revive, that's what's going on. You still call 911, but you've saved their life, and it's as simple as having a nasal spray in your home. So, but it is very accessible, and it's very easy to get. I got one today from my pharmacy just by requesting it. So it is available to everyone in the community.
I think something too, if I could to add to that, we found that oftentimes people are unfamiliar with this drug or this medication, and it's important to, I think, educate people too that there's no contraindications for this medication, meaning there's essentially, you could give it to anybody walking down the street and it's not going to adversely affect them. We found that some people are unfamiliar with it, and they they're in a stressful situation where they don't know, is this going to help them or hurt them? It's safe to say that that's not going to hurt anybody.
No. And if the person stays unconscious, something else is going on, and it was not opiates. But that, at least in the medical field, that's your number one assumption. If somebody come across an unconscious person that doesn't seem to be in any other distress, you would go this route first.
Gotcha. So we've heard a lot about what's going on. Let's talk about why it's happening. We'll go to you, Samantha. Maybe you could shed some light on this. Why do you think we're suddenly seeing so much more of this distress happening in our community?
Well, we've done several different interviews based on the new grant that we just got funding for, and a lot of them are going off of trying to reach that higher high. That's how they cope with life. They don't, when they don't have a job and they don't have vehicles and they have been in jail and now they're out of jail, but they have nowhere to go. That's their way of coping with it. A lot of them face generational trauma or some form of trauma in their lives.
Yeah, that makes sense. And so when you're doing these interviews and you're discovering sort of these common threads and themes, where can people go if they discover like, hey, this behavior is actually related to this thing and this thing needs to be handled and dealt with? What services are out there?
So there is TOTA Behavioral Health, and with any of these, you're gonna have, there's always a packet to fill out and steps that you're gonna have to take to be into these programs. But I mean, there's several different resources. The hospital has great resources. TOTA does. Cottonwood Clinical Services all have great resources.
Great. So you have some sheets of paper in your hand. What are these about?
Do.
Go for it.
So these are just some things that we've discovered in the last few months going into this new grant. In years 2015 to 2019, there were 38 prescription opioid deaths in San Juan County. There were 113 overdose deaths in 2019. 102 of those have been completed for data for multiple prescriptions. The current San Juan County overdose rate is 26.9 deaths per 100,000.
That's not insignificant. Those are pretty significant
Yes.
numbers. Yeah.
Yes.
Yeah.
The rate increased actually from 12.2 in 2015 to 26.9 in 2019.
Yeah. So, and maybe this is back to the community pharmacist, I don't know, but any of you can take it. But when you're thinking through, it's not uncommon for people to have surgeries, for people to hurt themselves and need for a time some sort of painkiller, and we certainly don't want to restrict that access, given that it is important. How do we protect ourselves? It's certainly an equal opportunity destroyer. I don't think there's one specific profile that falls into this kind of thing. So
There really isn't. It could be as young as a teen or your 85-year-old grandmother. You just really don't know who's predisposed to this or who's going to go down that path with it. I think it starts with the prescribers, really educating people on the medicine that they're prescribing and monitoring their usage or increase in usage. In the last, I'd say 5 years, the DEA and the state have really gone to great strides to decrease it nationally. And at the state level, they've put prescription limits. Even insurance companies now, somebody comes with a prescription for an opiate, they're only allowed 7 days. That's all the insurance will pay for. Because the idea is if you take it for 7 days, maybe you have a reaction, maybe it doesn't work for you, but you don't have 23 more days sitting in your medicine cabinet. So I think that's been beneficial. They've instituted the law that the prescriber must prescribe Narcan along with it. But unfortunately, insurance companies haven't hopped on board, so sometimes we get people who their opiate prescription's $2, their Narcan's $125. So there's certainly things that need to happen on that end because the drug is expensive and should be covered 100% just as a life-saving measure. At the state level, we have the P&P, which is any prescription that is a controlled substance gets reported to a state database. And our state participates with, I think, about 25 other states. So you come to my pharmacy, you have a prescription for Lortab from your dentist. We have to run a P&P automatically, so we look into your profile and it shows us that you filled Lortab in Durango yesterday and in Cortez, and then you went to Utah and got something, and then you were in Albuquerque last week. well, that's a sign of a problem, and it's our job to call the providers, let them know, and just make them aware that this is an issue so that hopefully your doctor will tackle that issue with you, or maybe we can help you find a resource, you know, go see a drug counselor or make some sort of referral on our end as well. And I know at least at our pharmacy, we try to tackle it not as you're a criminal, you're doing this horrible thing, but you might have a problem, let's go from there.
Right.
So
It's very sophisticated, actually. That's
we
good
try.
to know.
Yeah. Oh, it's fantastic. And I mean, I've been a pharmacist for 17 years, and we just had no idea. You know, you just kind of have a questionable person that came in with a dentist or an ER, like on a cycle. I mean, we've had patients that literally in their calendar had a cycle, and they would go here, Durango, Cortez, Utah, you know, and just, so they filled every month on time, and they seemed, you know, perfect. But it turned out they were doing that every single day all over the state and multiple states. So,
Right.
you know, so it's been leaps and bounds from where we were even just 10 years ago.
Right. Yeah. Wow. So I think, you know, it's clear what a community pharmacist does, what a police officer does, and what a fireman does. But tell us a bit more about San Juan Partnership, because I feel like that's something that would be helpful to know.
So we are drug prevention, harm reduction, just educating the community on what does go on and what resources are available.
Great. And what are the specific methods that you do that? I mean, I'm sure an online presence, probably a phone presence, but what other ways do we do that?
So we tend to do community health fairs. We run ads on the radio. We have billboards. We actually just finished and got in our new booklets that have all kinds of resources in them. We're very active in the schools.
Very
So
good. Yeah, great. And when you say harm reduction, I feel like the only thing that a lot of us think about is like a needle exchange or Narcan everywhere. What else does that involve for you guys?
So for a harm reduction for us, that basically comes down to we aren't going to sit here and tell you not to do it, but give you the resources to say, hey, like, you have to know how to use it and know how to use Narcan and know how to use your resources.
Mm-hmm. Yeah, very good. Awesome. Does anybody have anything else to add to
I think
anything?
one thing that the DEA and the state of New Mexico do is pill take-back. Located at San Juan County Sheriff's Office, Kirtland Substation, the Farmington Police Department, Lee Acres Substation for the Sheriff's Office, Aztec Police Department, and then the Aztec Sheriff's Office. If you walk into the lobby, there's just a big gray box that if you have pills that you're done using, or you know you're get them from a family member or something like that, you don't know what they are, you're allowed to go take them there and dispose them. I mean, no questions asked, and you know they take them, and then I think once a year the DEA comes down from Albuquerque and takes those back and disposes of them properly.
Gotcha. Because there is, yeah, go for
Well,
it.
and to your earlier question, I mean, that is the number one thing a parent, a grandparent, anyone can do to help prevent someone they know and love be exposed to medication, is not keep medicine in the house that you don't need. So your 7-day prescription you got from your dentist, you might have taken 2. Well, you still have it sitting there. Somebody with a problem might find that and abuse it, or a teen might find it and want to try it. So I think just not keeping unneeded medication in your home would be the number one thing you can do, and taking advantage of these facilities. And we tell everyone that comes in, because we get a lot of people trying to bring us bags of medicine, and unfortunately your pharmacy can't take it back for all kinds of reasons. But we always tell them, go to the sheriff's substation, go to the police department, no questions asked, you just go in and put it away, and they're going to dispose of it properly. And that's the number one thing you can do to protect those you love.
Yeah, and because is it unsafe to, like, there's like a flush list and a not flush list, right? Isn't that something that drugs, but it would just be better to just take it to the police department
Right.
or whatever? Yeah.
Right, yeah, there is, the DEA does publish a flush list and a non-flush list, but ideally, we don't want drugs in our water system, so
Right.
it's best to just dispose of them properly.
Right, that makes sense. Yeah. Anything to add, Captain?
No, I mean, I think it's important too, because, I mean, this affects more than just a normal drug user. I think it's important to kind of recognize signs and symptoms of an overdose, because this can happen. I mean, we often see it in like elderly care facilities and things like that, where these people are on, they have chronic pain, and so it's important for folks to kind of recognize, you know, an overdose when it's an overdose. Altered mental status obviously was early on, like they're high. But the most important thing to recognize is basically like their respiratory effort and rate. They'll become lethargic, and then, I mean, oftentimes by the time we get there, they're well on their way, you know, to a poor outcome. So early recognition of that, really that respiratory rate and effort, breathing slowly, shallowly, that type of thing. The earlier that's recognized, the earlier obviously that we can get there and help them. And that's basically the number one thing that we treat with an overdose is their respiratory illness, so to speak.
Right, that makes sense.
And that goes the same for old people, little kids, you know, everybody's basically going to present the same way.
Right. And if you, I mean, obviously calling 911 would be the first step. If you didn't have any Narcan I would think would be about the same time. And then if you didn't have any Narcan, what, is there anything else you could do besides just wait for things?
Well, yeah, I mean, yeah, for sure. I mean, one very important thing that oftentimes gets overlooked is putting these people on their side, which is very simple. But, I mean, these people are going to vomit. That's obviously cause for concern. So we see a lot of people throwing these folks in showers and cold water. That does nothing for them. In fact, it makes our job harder. It does nothing. So I would encourage people not to do that. Putting them on their side on the floor is really as important as anything other than giving them Narcan, really.
Mm-hmm. Gotcha. Great.
And left or right side doesn't matter. Either way.
Right, okay. Yeah, I want to get very, very specific here. Yeah, this is saving lives we're talking about. And this is the last question, and it's basically related to this overdose, seeing somebody who's had an overdose, and that's about the Good Samaritan law. So Corporal Davis, you want to take that?
Yeah, so the Good Samaritan law in the state of New Mexico really just says that if you are with someone, you know, an illegal narcotic overdose, being heroin, fentanyl, illegal fentanyl, any type of overdose, if you call the police and ambulance shows up and police conduct their investigation for the overdose, nobody's going to get charged. Nobody's able to get charged with any illegal narcotics that law enforcement finds or anything like that. And what that's doing is just really assuring people know that they're not going to get in trouble for calling us whenever they're trying to, you know, help their friend or whoever it is. You're not going to get in trouble. So.
Nice. Great. So I think that wraps it up for us, unless you guys have more comments to throw in there, or, you know, tell us, San Juan Partnership, how do we find you guys?
We are actually located 1515 East 20th, so we're across from Grease Monkey and sit right next door in the little plaza next to Durango Joe's off 20th.
Great. And if I have sort of any questions and concerns, I can just walk in and you guys can steer the way?
Yes.
Great. Awesome. So thank you guys so much for offering of your time and talents to this community conversation, and hopefully we learned a lot today. So thanks.
Yep,
Thank
And
you.
thank you guys for joining.